be adaptable in the technology, be adaptable in the services, but the experience can remain consistent.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Melissa DelFino. Melissa is the founder of Modern Distinction, a structured process that helps derm offices strengthen their workflows. Welcome, Melissa. Thank you for joining me.
Thank you for having me. I'm so excited to be here.
Yes. So, when I saw workflows, that was like right up my alley. That's exactly what I love helping offices, because if you don't have a good workflow, then, you're going to have some issues.
100%.
You see so many problems in the office that just stem from, everybody not working together and kind of that mindset. I feel like I see a lot of, not just in dermatology, but in any job. And, when people don't work together, then stuff doesn't get done and you don't have a happy team. Number one, I feel like there's so much more collaboration and people get along and they're happier in their job when everybody understands, okay, yes, you may have a specific role, but you still all have to work together to be able to make the job work the best. So, yeah, I'm excited to chat with you. And I want to hear a little bit about how you got into dermatology in the first place. You've got a psychology background.
Yes. So it's funny you mentioned I actually worked in restaurants prior to healthcare.
Mhm.
And it's so true. Like there's so many moving parts, and a lot of what I implement in derm practices really is applicable to any business. So when I decided to go for my master's, I was in restaurants and I was like, this really isn't sustainable. I need to find like maybe like a desk job or something like that. So I saw on Craigslist an ad for a call center at a dermatology group, and I decided to hop on it. And when I mentioned that I worked in restaurants, they were like, perfect candidate. And I still to this day believe that, because, when you're in that like patient facing or customer facing role,
Mhm.
you really can be so adaptable and personable. And it's extremely important to like find that in your team.
Yeah, I love that. It's funny because I never thought of, restaurant industry being somewhere where you learn a lot.
Yeah.
That's a great starting point. I mean, my first job was a hostess at a restaurant and then moved into, serving and bartending, but it teaches you so much, the customer experience and just having that passion to help other people.
Yeah. Definitely got to be a people pleaser to work in restaurants and healthcare. And
Right.
I think too, it's kind of like, and I tell my staff, it's a Broadway show, right? So there's everyone has a role, whether it's in a play or like in restaurants or in healthcare. And that's where we're talking about the first interaction with front desk, then the medical assistants, bringing a patient in the room, and then the experience with the provider. And then again, what happens when they leave that office.
Hmm. Yeah. So tell me a little bit about how your background in sociology and psychology influences the way that you approach leadership and team dynamics.
Yeah, for sure. I think having the experience going through a master's program, I mean, it wasn't my ideal situation to stay in healthcare, well, in derm specifically. I wanted to really counsel patients in prison reform. That was really the goal.
Hmm.
And I didn't really get the opportunity to get a job in that field. And I decided, you know what? I do feel that I have enough organizational psychology skill at this point where I can apply this in real time and not feel like I just wasted all this money on a master's degree that I'm not
Hmm.
using. I do a lot of team building workshops with staff, with clients where they need help with developing their leadership skills and doing more so. How do we do mediations even? There's a lot of times where leaders don't know how to deal with conflict and they don't
Hmm.
know how to kind of provide constructive criticism, so that's really where that organizational psychology and just the know-how comes into play in the day to
Mhm.
day.
Yeah.
So even when we're hiring for leadership, having specific questions that we ask, how do we identify if someone is a good fit and adaptable? Those are things that we try to teach
Mhm.
our clients and leadership.
Yeah. What are some of the things that you look for? Because I feel like sometimes interviews can be really difficult. You come in and they bring in their resume and they're a really good talker and you're like, "Oh, this person sounds amazing." And then come to find out like they're not exactly what you thought when they are actually doing the job. Are there any social cues that you look for or ways that they speak to understand, like, if they would be a really good fit?
Yeah, so I have to say people can be tricky, like, that is a thing, right? So, there's times where you make the hire. I always say, make the hire, but be quick to fire if the person's really not a good fit. And, like, they have that 90-day period, so you really need to keep a close eye on them during that time, but also provide the constructive criticism, and how
Mhm.
we deliver that criticism is extremely important in success of the role so that they
Mhm.
supersede that 90 days. If you really feel like they can't make the 90-day cut,
Mm.
then, it has to be documented, and, like, we need to make sure that they're made aware of
Mhm.
how they're performing, and then how do we navigate leadership to, like, have these conversations, because it's not easy giving feedback.
Mhm.
And I find that that's the biggest struggle that a lot of offices have, where, okay, well, how do I give feedback in a moment? And it's like, we don't have to give feedback directly in a moment, because that's sometimes when things are heated, right?
Mhm.
So being able to document or reflect on how we responded in a moment, and then say, let's set a time aside to actually talk about what are the expectations, and compliment sandwich, right? You're doing
Mhm.
great with this. However, I am noticing that maybe we need some improvement here, and I'm going to give you a timeline, and
Mm.
then we can revisit,
Yeah.
and really, like, setting those dates together. That's sometimes, like, my approach, but it's not always easy to interview for, because people can be just really good talkers, and sometimes eye contact, or, like, fidgeting, which is also a normal thing in interviews, right? Not
Mhm.
everyone's open to, like, connecting with the interviewer, because they're just in their head, like, how am I going to answer the next question,
Right.
right?
Yeah.
So it's not easy, and it's not something you can always interview for, and I've definitely been duped a couple times, but I think, in this day and age, like, being able to provide feedback is the most important thing, because
Mhm.
the way it's received and the way it's provided just goes
Mhm.
hand in hand with setting up someone for success, or setting the expectation that they might not be a good fit.
Yeah. Yeah, I like that. Especially like that 90-day time frame, that kind of gives you time to say, okay, is this really working? Can you handle healthcare is so fast paced and
Yes,
you've got to get things right. Otherwise, you've got patients that are waiting, that
correct.
are frustrated or, even employees. And if employees are not happy, then the patients see that and
Yes.
everybody else can see that. So, I mean, that's a huge thing. And it's always that trickle down effect. So, however management is, that's how they're setting that tone and setting the environment for their staff. And the staff is doing the same thing with their patients. And yeah, it's a tricky thing in healthcare.
It is, and that's the thing too, is, like, working alongside doctors. Like, doctors just have a reputation for being, like, quick and snappy, and sometimes really demanding, and that's okay. But it's also, we have to be adaptable with the times too. I feel like a lot of people are just way more open about their emotions, and that's a wonderful thing. Like, I really encourage staff to be open about their emotions.
Mhm.
And I say it in any interview that I have. I'm like, I didn't get to be a therapist, but I always make sure, like, I have my staff on my therapy couch, because I have a therapy couch in my office. So I'm
Nice.
like, sit down. You want to talk? Talk. You want to
Mhm.
scream? Scream. Like, go for it. Let's take a breath. Like, I want to hear about your experience in the day to day, and I want to talk about how do we make it better, or what's the
Mhm.
next step, right? Like, if we come across this issue again, like, how do we navigate it? And how do we navigate it as a team? How can I support you, or how can another staff member support you?
Mhm. You know what? Actually, that makes so much sense. I feel like everybody needs one
Needs
of
to
those
vent.
counts. Yeah, you gotta have that venting session. You gotta have that time. But also, I think people also need to understand, okay, there's a time to vent. There's maybe not the right people to vent to sometimes
Mhm.
as well, but being able to get that out and kind of speak your mind, but also be able to say, okay, now that I've done that, let's take a step back and think about, the situation that caused, all the frustration.
For
Because,
sure.
yeah, because then you're going back into it and, you're just upset. And
Mhm.
it's a weird dynamic. I mean, I've been in multiple different situations like that where I've been in a job where it was just very high level. It's still healthcare, it wasn't in dermatology, but it was very high level stress and a lot of micromanagement. And that like completely just caused way more stress for everybody. But it actually triggered my migraines. I never had migraines until I worked at that job.
Oh my gosh.
And it was wild. But, it really just shows how there's so many different approaches and not everybody's got it right. So I love what you're doing with trying to change that and helping offices understand the need for
Yeah,
efficiency.
and my biggest thing too is, like, emotional regulation, and how do we teach leaders to do that? And
Mhm.
everyone has their own way, and I think when you kind of work with a doctor or a manager, because a lot of small private practices, they don't even have managers, right? So
Mhm.
the staff are working directly with the doctor, and that can be extremely intimidating. So, like, if the doctor is not warm, and listen, we're all frustrated. Like, there's times where we're frustrated, but it's like, what do we do in those moments?
Mhm.
Right? And if it's a matter of stepping away and taking a breath, and the staff see that, okay, like, he's frustrated, we're going to take a breath, or like, she's really upset, let me ask her to step aside. Like, being able to provide that
Mhm.
is extremely crucial, because then the staff feels safe to say,
Mhm.
like, okay, I'm feeling frustrated, like, do you mind covering me for a second? Like, those are those are just like ways teams can communicate to just provide better care for the patient. Because, like, can you imagine
Mhm.
a medical assistant coming in and, like, you could clearly tell they were just crying or something? Like,
Mhm.
what does that communicate to the patient?
Right. Yeah, that's terrible. It's hard to like how do you talk to staff about okay, maybe they were in a bad situation and their first instinct is to just snap back. And like is there a time and place for that? And if not, like how do you help understand okay, you got to just sometimes bite your tongue.
Yeah, I say this a lot too, and people think, oh, like, sometimes, "Oh, is she being passive?" And it's like, "No, we're not being passive. We're just, like, taking a moment," because patients
Mhm.
come in, and especially, like, in healthcare, in derm, there's a mental health component to that, right? So they're
Mhm.
already coming in upset, self-conscious, and going through what they're going through, and we need to be compassionate, and sometimes patients are adamant about, "No, I know I have this diagnosis," or this medication worked for me 5 years ago and I want that medication. But everyone has their different clinical approach, and, you know, being able to, if a patient is being combative in that moment, knowing I'm about to snap, like,
Mhm.
I'm gonna step out a second. Let me review your chart a little bit more, and then take a breath. Take a
Yeah.
walk down the hall and come right back, because just even 2 seconds of stepping out can really help you. And, like, if the medical assistant, I mean, the medical assistants, I've never seen one snap on anyone, but, like, I think
Maybe
it's
not
more
on
so like if
patients, but
providing
at
the,
least yeah.
yeah, but
Maybe on
patients can
other
be
employees
snappy.
too. But yeah, patients can
Yeah, like, and
too.
when they're
Yeah.
not getting what they want, but it's a matter of, like, education, like,
Mhm.
this might have worked for you in the past, but it's not actually gonna work for this condition. You had this previously, and, just patient education, I think, is, like, really the key factor in that.
Mhm.
Some doctors I've worked with, they'll be like, "Do you trust Doctor Google over me?" And it's like, "Don't say that." Like, you know?
Right. That's funny because it's true.
I know. It's funny because it's true, but it's real, and, like, patients don't wanna hear that, and then they're gonna
Mhm.
go to Google and then write
Mhm.
you a review. So
Right,
it's like
exactly. So, okay, do you work with patient assistance and access questions, things like that, like within the office, or are you specifically working with like your upper management, or is that just kind of managing the whole practice?
so I am still an active practice manager, so I do work with everyone. But when I am working with clients, I'm mostly working with upper management or the owner. And then if they need additional like staff training, we'll do like virtual training session or I'm creating SOPs to help them or their managers
Mhm.
provide further training for their medical assistants or front desk.
Okay. So, can you share an example of how implementing structured systems or team trainings has directly improved a patient's experience or access to care?
Yeah, absolutely. So, I mean, having even just documented FAQs that front desk or medical assistants can reference during the
Mhm.
day to day, whether it's like prescription refill request protocols, it really helps kind of elevate the patient experience because our medical assistants and front desk, they're still professionals and they're able to answer basic questions without providing medical advice.
Mhm.
And when you have that level of service, the patient feels cared for and they feel safe. And I think that's the biggest thing. It really enhances the patient experience because now I'm speaking with someone who I trust,
Mhm.
the doctor trusts them to be the one answering these kinds of questions as well. So it just shows that extra level of care when you have a front desk or medical assistant that has the knowledge to provide, hey, I can give you that refill, but the doctor does want to see you in 3 months. So it's really important that we make your follow up appointment now.
Mhm. Yeah, no, that makes sense. You're the face of the company, the front desk is. And, I worked in all these different roles within the derm office. So I know how stressful sometimes the front desk can be. And then you've got, everybody else running up to you. Hey, call this patient. Can you do this? Can you schedule that? And then you've got patients walking in the front, and you got to
Yeah.
enter in all the demographic information. And, there's so many different things happening, but having a set like protocols and those processes, it makes such a huge difference. And I understand the high stress level, but and it kind of goes back to your hiring too. I think that's one of the important things that a lot of offices sometimes can miss is putting the right person in the right position.
Yeah.
Especially if it's the front desk. You've got to make sure that your front desk people can multitask and manage a high volume, high touch point, lots of different things going on, lots of emotions going on, and
Yes.
not just and still have a happy smile on their face.
Keep it together. And that's the thing too. So part of things I encourage when hiring, if I'm not the one doing the hiring, is a working interview, right? Whether it's a medical assistant, even if I'm hiring for a provider, I want to see you in action. Come in for 2 hours.
Mhm,
And I want you to one, shadow, and then the last hour you would essentially interact.
mhm,
So whether it's like front desk, medical assistant, or provider, front desk especially, will be like, "Okay, assessment is I need you to answer a phone call. I just wanna hear your greeting
mhm,
or confirm an appointment." So we wanna hear the way you're speaking to a patient or leaving a voicemail, and then checking in and out someone. Like, we don't need to do, like, the whole nitty-gritty of,
mhm.
like, taking the financials if it's something that's complex, if they've had, like, a procedure, but just knowing how to, like, navigate the system briefly is pretty important.
Yeah, absolutely. I've heard multiple offices, actually I've gone into some offices where, front desk was just like, "Can I help you?" And it was just like so off-putting that I'm like, "Do
Like,
I
in a
even wanna"
monotone?
Yeah, "Do I even wanna come here? Because 'Cause I'm scared now."
Yeah. I
This is
think
not
too, like,
helpful.
being consistent with the greetings important and just the flow of even the medical assistants, the way they bring the patient in, making sure they're introducing themselves. "Hi, my name is I'm the medical
Mhm.
assistant, and I'll be assisting Doctor so and so today." Like, that's really important to just have it consistent,
Yeah.
and that's why I always say, "It's a Broadway show." Like, I
Right.
always if you ask any of the people I've worked with, they're like, "What's Melissa's line?" it's a Broadway show.
Okay, tell me a little bit more about that. I love that. Where did you come up with that?
I don't even know. I think being able to be, like, personable and coming up with something catchy that they're gonna remember,
Mhm.
they're always yeah, they're like, "It's a Broadway show." I'm like, "Yeah,
Yeah.
it's a Broadway show, so put on a smile." I had one girl who was, like, just always monotone, and I'd be like, "Please, just smile." And
Mhm.
she's like, "It's not my thing." And I'm like, "That wasn't my hire." But it's like, you can't always change those things, but I think too,
Mhm.
like, reiterating why it's important and how, their role is so integral in the patient care
Mhm.
experience, it changes it.
Yeah. I know. I think sometimes, front desk can kind of feel a little bit more minimized, like, "Oh, my job is not as important
It is so
as
important.
the medical assistant or the doctor," obviously, but yeah, it is important, and I think it is important to make sure that everybody does feel empowered in their roles so that they can do a better job and that they wanna do a better job.
Mhm.
How in your experience, what's the most common misconception about, patient access and how practices can shift their approach to better support their patients in difficult situations?
Yeah. I think touching base on insurance is an extremely important part of this question here. So I think getting the front desk educated, even the medical assistants educated on insurance, just the basics of insurance and like what is considered medical and what is
Mhm.
considered cosmetic. A lot of pushback that I get from patients is I pay so much for my plan. Why isn't this covered? And it's like,
Yeah.
what you pay for your plan is what you pay for your plan. That's the policy you chose. However, that doesn't necessarily determine what is covered by insurance.
Mhm.
And having maybe like a script that front desk or medical assistants can reference is extremely important for them to navigate those kind of conversations because
Mhm.
patients get pretty upset when they find out that something is not covered or even their deductible, right? They're responsible for their deductible. I pay so much for my plan and I have a deductible. Like, what are you talking about? And, we don't have control over the plan that they choose. So, doing eligibility checks and making sure that we're kind of educating the patient on their plan too, having some sort of automated system where we just send out a text message. Hey, it's January, right? January is like the slowest season in healthcare, to be honest with you, because deductibles reset. So people think, oh, I'm not going to go see anyone because I'm going to have to pay for it. But it's like, you're going to have to pay for it whether you come in January or you come in May. So, letting the staff kind of educate the patient and say, "Hey, you have your deductible. This might be going towards a deductible. You have a remaining balance of blah blah," right?
Mhm.
So it's extremely important to like be transparent and kind of proactive when we're seeing our patients on the schedule. Let them know this ahead of time because at the end of the day, they come in and then they get a bill. They're going to say, "Surprise bill, I'm not
Mhm.
paying." But in reality, it still is their responsibility.
Yeah. So you do does your office currently do both cosmetic and general derm?
The
Mhm.
practice I work for, we both are cosmetic and derm. A lot of the clients that I have, they do a mix of both too. And that's where things also get kind of hairy. So, like, let's just say, for instance, someone's coming in for SK, seborrheic keratosis. It's not something that is covered by insurance. But
Mhm.
let's say they're also coming in for a full body skin exam, right? That's where things get
Mhm.
extremely confusing for the patient because we have to be clear that we're doing a full body skin exam today. I'm seeing some spots here. This is not cancerous. These are completely benign, nothing to worry about. And then they're like, well, I want them removed. Sure, we can absolutely remove them, but it is not medically necessary to your
Mhm.
insurance and it is not going to be covered. And then like provide them a quote, you know?
Yeah.
And sometimes they'll say, "Well, my friend had something similar and they got that covered by insurance," and it's like a completely different diagnosis. So being able to,
Right.
like, navigate those conversations and having, like, some sort of FAQ that the staff are able to, like, have in their training is
Mhm.
really important.
Yeah. Okay, so let's talk a little bit about training and how that works. There's so many different roles within the office. How do you manage the training side of things, and how often do you find that it's important to do the training?
Yeah, so training is such a difficult thing, especially in small private practice. I try to do buddy system where you're shadowing a buddy, right? So let's say, Sally's going to go on vacation. She's not going to be a buddy for a while. So you have your new staff member with someone who has no like time off scheduled, and we know that they're pretty like senior in their role at this point, and you provide them with all the training documents, have them essentially shadow for at least a couple days, and then start slow. All
Mhm.
right, I want to see you do a, chief complaint. How do you bring in a patient? How do you present it to the doctor? Here's how we work the EMR. And a lot of EMR systems already have like training modules. So having them access that in their first couple days, sit aside, do the training modules in between patients, or if they're open, like sit them at the end of the day and start training there, and then slowly integrate them in the day to day.
Mhm.
Sometimes I do find that there's gaps in training where you're doing certain procedures. We don't do certain procedures every single day. It's not part of our everyday, and that's where it can get a little hairy with training because they're not always exposed to
Right.
certain procedures and things. So being able to pull them in and say, "Hey, you've not seen this before," or like that buddy that they're with is
Mhm.
responsible to recognize, "Hey, you haven't seen this before. Come in the room with me. I want to show you." Even just stand there, right,
Mhm.
and watch. So that's really important. Same with front desk. There's a lot of moving parts, but a lot of it from my experience, like when I started in healthcare, it's like you get thrown to the wolves. There's no way
Mhm.
like you're just learning as you go.
Right.
And in a lot of places, it's still like that. The goal for my company really is to create an online platform where we have modules that they're doing within their first 90 days, and we're
Mhm.
completing courses, getting a certificate of completion, and then assessing. There's going to be like a multiple choice question or like an interactive portion of a module where they can test their knowledge and their know-how. So
Mhm.
that's the ultimate goal, and I do find that I'm really hoping like end of 2026 we're there and practices can implement that, and now you can monitor and measure the success in real time and then see how it reflects with the patient experience.
Mhm. Yeah, no, that's so good. I think, the training side is so important. I feel like, there still has to be some of that refresher as well. So,
Yeah.
okay, now you can go back and do these. I mean, there is definitely so much hands-on learning that has to happen, but at the same time, when especially when there's new biologics, and we see this a lot like within
Yes.
my company where we're working with an office and we're managing all their prior authorizations and everything, and then they get new staff that comes in, and then sometimes they're like, we've had a couple offices do this before, and they're like, well, we've got a new MA, but they're not going to be doing any of the biologic patients yet.
Yeah,
That's
that's
not
very
really.
common. It's very common.
And then we get a patient that's on a biologic and somehow it slips through. And every single time it happens. So I'm like,
Mhm.
we can help with that. We can help do some of that training to make sure that they're up to speed as far as what is needed, the enrollment forms or pharmacy benefit cards, different things like that, or specific things that they have to capture in those chart notes in order to get a good prior authorization approval. And that's so difficult, but it's like, okay, start from the beginning. And I get, like usually when you're hiring a new person, it's because you're busy and you need to get them
Yeah,
in.
right,
So
right,
there's that time in between there that it's difficult, but it's kind of essential to make sure that they are fluent in all of that and they've got somebody that is working through, and you've got those protocols in
for
place so they
sure.
are not missing things.
So one thing I do is so I do have actually it's a biologic FAQ, and
Mhm.
it's like each biologic, what does it treat? What are the like what's the sig, right? So what's the
Mhm.
dosage, frequency? What are the notes required so that when we do the PA,
Mhm.
what's the enrollment form? What's the portal? Who's the rep, right? So it's
Right.
kind of it's like a no-brainer if like let's say you just have to get thrown in, like you can kind of reference this, and it's like fillable, right? So every office has a different rep depending on where you're located. But also, I try to have the staff get the reps in right? Like,
Mhm.
be part of the training, get them
Yeah.
in to constantly be top
That's
of mind.
huge.
And
Yes.
also, like, it's beneficial for not just the staff, but also the doctor, like, they get updated on
Mhm.
what's going on, and then the staff get updated in the enrollment and how to do the PA. Another thing that I do is rotate the responsibility, so, like, I'll
Mhm.
send out a schedule, and I'm like, "You're doing PAs, you're doing
Mm.
messages and calls, and then you're handling biopsy callbacks," like, and it's rotated every single week so that no one is not aware. You know what I mean? Everyone's aware how
Mhm.
to do their part.
Right.
Because in the absence of one, like, a whole, like, job completely goes to the wayside, and then you're like, "What happened?" And then patients are
Yeah.
upset.
Yeah. With the biologics, I see there's so much time that goes into it. You could essentially get a PA approved and get a patient on therapy within 3 to 4 days, but then there's sometimes it could take 7 to 10 days or sometimes even
30.
longer. Yeah. Hopefully not
Yeah,
that much. But
yeah.
yeah, and that happens. So how do you have your team manage that when, if they're rotating?
So really proper documentation in a patient chart, making sure everything's uploaded. Any correspondence that you get from the insurance or the pharmacy is so important. And then also touching base with the patient. I will say I have some of my offices kind of utilize Tandem for
Mm,
enrollments, and we've seen some benefit to that. So utilizing AI in some capacity where they're
mhm,
helping with even the enrollment, getting them into that bridge program, but again, we're not replacing the human being.
mhm,
We're still like having to go into a system and click like approve or sign
mhm.
here or provide a note, right? But it's all in one place. So that's
Yeah.
where that's been helpful.
Yeah. I know. I think that is so important. AI is definitely it's here. It's not going anywhere. We've got to be able to learn how to work with it. But at the same time, there's still, especially in healthcare, there's still got a cautionary, side of things. And you've got to make sure that you're following up on things. And
Right.
and so we can't rely on it like it is 100%. Use it as a tool, but also obviously use our
Don't
own
rely on it
discretion.
too much.
Yeah, and double check stuff, especially, if we're using it, and I talk about this all the time because ChatGPT can be great for helping me write appeal letters.
Mhm.
But I still review it all. I still
Yes.
make sure that I'm pulling, okay, where did you get this fact from?
Right.
Where's this information coming from? I want to make sure that it's accurate and that if I'm using it and sending it in, now you've got your doctor's name attached to that.
Right.
And that's a legal document now. So if
Mhm.
you're getting that information from the internet, you better make sure that it's correct. And, if you're putting anything into the patient's chart, it needs to be done well. I've
Right.
even had like specialty pharmacies before in the past where they would write some of these appeal letters. They weren't using it was before AI, but they would write these appeal letters and then I'd read over it and there would be so many clerical errors and mistakes and it would infuriate me. I'm like, why are you sending me this? Like, is this what you're sending out? Because sometimes they would send stuff without even asking for a review. So I'm like, no, review everything and make
Yeah.
sure that it is up to par because if your doctor's name is on that, that's them. That's
Yeah.
a
And
liability for
and two,
them.
you're much quicker to get a denial with a letter that is just not accurate,
Yes.
and that's the biggest thing. Now we're impeding patient care, and
Mhm.
they're frustrated because they think it's like a clerical issue on our part,
Right.
and we're relying on other moving parts.
Mhm. Yeah, and the
And
insurance companies are quick to put it on the doctor's office. Say, "Well, your doctor's office didn't do this, and they didn't send
mhm,
us this." And in all reality, we probably did, and so the patient's frustrated, and they call us back, and they're like, well, they said that you didn't submit the proper information, and so that's why it was denied. So what are
right,
you guys doing, and why haven't you gotten my medication? Or and it sets the tone, because then now you've got a history of that, and the patient's going to remember that. So either they're going to continue to come back and deal with subpar service or and
right,
frustration, or go somewhere else where they know that they're going to actually get the medication that they need in a timely manner.
right.
And that's the hard part.
Aside from biologics, like, in derm, a lot of,
Mhm.
like, acne topicals and other
Right.
medications are just not covered. So it's
Yeah.
like, sending to specialty pharmacy where they're able to help with a prior auth or even provide a cheaper cash price to a
Mhm.
patient is so important. Like I really stress like I'm sorry if we're not able to say CVS, but like the the big name pharmacies, like
Mhm.
we got to get rid of those. Some of them, the
Yeah.
patients are not quick to accept that we send to specialty, but I'm like,
Mhm.
it's not always covered. Like that, just
Yeah.
be transparent about that. We're a specialty and we use specialty medication and they are
Mhm.
not typically covered by insurance.
Yeah.
That's why we send to specialty pharmacies for that support. If it's not covered, they can provide you a cheaper cash price. And they're like, no, I want my local. I want my local. I'm like,
Yeah.
okay,
Yeah,
I tried.
it's frustrating, but there's such a learning curve, especially now because there's so many changes with insurance companies, and now you're getting some of these smaller carve out plans because these companies don't want to pay. They don't want
Hmm.
to pay, and it's frustrating not only for us because we're doing everything that we can and dealing with the back and forth with the insurance company. That takes a lot of time, sitting on the phone with an insurance company trying to fight with them to say why you actually need the medication that the doctor prescribed versus their formulary that may not even make sense. It's a lot, it's a process. And so if we don't learn all of that, we can run into so many issues. And
Yeah.
sometimes even these pharmacies, it's the back and forth. It's like, oh well, you need to call the insurance company. And then the insurance company and the pharmacy don't even talk even though they may be owned by the same company. they don't talk.
I know.
So, it's craziness, but
And two,
yeah.
this even goes beyond prescriptions, like even
Mhm.
with procedures. And let's talk about like Mohs micrographic surgery, a skin cancer procedure is
Mhm.
not always covered depending on the body location
Yeah.
and even the type of closure, right? So like we're closing up a wound and potentially not getting paid on it because an auth may have been denied. Like we're
Mhm.
just learning now that certain payers are not going to cover certain types of closures. And it's like, we don't even know the type of closure until the patient's on the table. So now you're
Yeah.
saying I have to call the insurance while the patient's on the table? Like, that's out of
That's wild.
control.
Mhm.
And like, we don't want to tell, like, you don't want to be that transparent with a patient either. Like, hey, we don't know what's going to happen. Like,
Mhm.
we want to make sure that we're trying to get all of our ducks in a row prior to them coming in. So
Right.
insurances provide such a restriction in terms of the
Mhm.
care because I mean something is like skin cancer, like why isn't everything covered, right?
Right.
It should always be covered. It's skin
Right.
cancer. So,
Yeah.
these are the kinds of things that we want to stay on top of, and these
Mhm.
things change sometimes even quarterly.
Yeah.
And practice managers, some of them are not involved in billing operations at all. So it's
Mhm.
like, how do you have the right way of getting the knowledge, right? I think partnering with like a really good RCM that is staying on top of your appeals and denials and making sure that
Mhm.
they're appealing or providing like a monthly meeting that they can educate you. There's a
Mhm.
lot of these like AI billing companies now that are just like writing off balances and like people don't even know about it. Like the
Wow.
practice owners don't even know that they're losing revenue because
Mm.
the way they present the reports are like, you're actually doing great. Everything's getting paid. No, actually not.
Wow.
So these
That's
are things that I
wild.
kind of like when I make an assessment of a practice, like I try to look at their financial overview first
Mhm.
and then like what are their billing operations and all of these things. And that's really like the bread and butter of like how a practice runs too. So
Yeah. So, what are the most common bottlenecks that you see in practices before you start consulting with them?
definitely financials, right? That's the
Mhm.
first thing is, okay, are we actually getting paid on the claims that we're sending out? And how much does staff know about what insurance is, right?
Mm.
If they're not educated enough to collect a copay, collect a patient balance at the front, like those are the first things that we kind of like look at. I like to kind of just sit and observe and then we go through reports and financial overview and then I kind of look at, okay, what do we want the patient experience to look like? So I'll ask the
Mhm.
owner, what does patient care mean to you and what do you want the experience to look like, and does your staff know, right?
Yeah.
And
That's
then how do
huge.
we create the standardization of that?
Mhm. I love that. It sets the tone for sure. It's like, how do you want your staff to feel? How do you want your patients to feel when they
Mhm.
come into your office? That's huge. So you describe modern distinction as a mentorship movement. What does purposeful mentorship look like in action for the practices that you work with?
Purposeful mentorship to me looks like creating a culture of education and, allowing staff to ask questions and being part of the patient experience and like just kind of identifying like what that looks like. So again,
Mhm,
going back to, talking to the owners and saying, what does it mean to you? And does your staff know? There's a lot of times where doctors are just in communication with each other and they're all like, "Hey, I do this, I do that, I do this, I do that." And they want to implement everything at once. And
mhm,
it's just like chaotic. Like, we can't have the staff do 20 different things to just, identify a patient experience and execute it well.
mhm,
We need to focus on like one or two things that we can do. And even as simple as like I just made a post on Instagram recently and there's like three zero cost tips, right? Like saying a patient's name, right? When you're greeting them, having a
mhm,
consistent greeting. What does the
yeah,
follow-up look like? These kind of things. You don't even have to spend money on anything fancy.
mhm,
So, having everyone on board and again, creating those SOPs, that's purposeful mentorship.
yeah. It's always the little things,
Mhm.
that make you feel, "Oh my gosh, she remembered this," or yeah,
Yeah,
I love it.
yeah.
What is one of the biggest mistakes that practice owners make when trying to standardize operations on their own?
One, implementing too many things at once,
Yeah.
and two, not being able to make a decision. I
Mm,
think that's, like, one of the biggest things, I've seen is they have a really hard time executing it because they're not really set in it,
mhm,
and it's like, "Okay, you can take time." Like, no one needs to make a decision at this second, but let's talk about it. Let's identify the pros and cons, and then what are the ways to execute it? So, I think, not focusing on too many things at once, and then also seek guidance. Like, not everyone's able to have a manager,
mhm,
when they first start. Like, I work with a lot of, like, startup practices, so it's like they're solo. They're one person, and they're like, "Okay, I have a front desk and a medical assistant."
mhm,
But you're bare bones staffed right now, and we're relying on them, and now you're the manager. How are you gonna manage while you're seeing patients?
mhm,
So seeking expert guidance, having a consultant, that's why I say like, okay, I can help you with your handbook, standardization of your SOPs, and let's get eventually the platform going where we can have everyone do their onboarding online and you can see it in real time.
mhm. Yeah, no, that makes sense. I think that's important too. A lot of small offices are not able to start out with a manager or all these different roles. Would you say your most essential roles would be front desk and medical assistant
And definitely a manager. I
and
mean,
manager?
like
Yeah.
even like a senior front desk that kind of
Mm,
knows the ins and outs.
mhm.
So like when we're hiring and we're just opening, like you need someone who has experience for sure.
Yeah.
Like I do hire a lot of like pre-med, pre-PA students for my medical assistants because they're very easily adaptable. Like they're quick learners. They want to learn. They know that the knowledge that they're getting in the day to day will be applied, but
Mhm.
like you still need someone with experience. So like don't
Yeah.
cut the corners when you're hiring. You're investing in your staff because
Mhm.
they're your marketing at the end of the day and they're the ones that are delivering the care too.
Yeah. So after, say we've done all the onboarding and everything and the office is up and running, they're pretty efficient. Do you go back and say, okay, now let's take a step back and look at everything and see how we can be more effective or even more efficient to like reevaluate what that current process is?
So I like to do team meetings, right? Where and I micro team meetings because it's
Mhm,
really hard, especially like if you're working with a large practice or multi-location practices, it's really hard to do that and then it just never gets done. So like having huddles with staff and documenting like one agenda and we're
mhm,
checking off what was communicated so everyone's on the same page.
mhm,
And then two, like discussing what was the worst part of like your week, right? What can we change about that? What can we do better next time? And then like services people are asking for that maybe we don't offer,
Mhm.
you know? But in terms of like patient experience, if we're finding that it's working, if it's not broke, don't fix it. I
Right.
would say be adaptable in the technology, be adaptable in the services, but the experience can remain consistent.
Mm. That's good. That makes a lot of sense. You don't wanna change up too much because then
Yeah,
patients are gonna be like, "Ah, what's happening?
right.
What are
Yeah,
we
because then they're
doing?"
like, I came in here like a year ago and it's totally different office, you know?
Right. Yeah. Well, that happens sometimes when you have a lot of staff turnover and things like that. So,
Right.
yeah, that makes a lot of sense. So, what would you say to a derm practice owner about the value of efficient workflow and processes?
Definitely don't take it for granted. And back to if it's not broken, don't fix. Like if you have a good
Mhm.
system, keep it consistent and keep it documented if you can. If you don't have a document in place that you
Mhm.
can have referenced for onboarding, that's gonna staff turnover happens all the time. Like
Mhm.
people rely on one consistent person, and it's the curse of competency. You don't want to burn out the one person that you have that knows how to do everything. So it's important to have training set in place where when newcomers are here, you're able to be prepared for their onboarding.
Mhm. Yeah, that's good. So, okay, you are so busy running your business and also managing an office as well. What do you do in your downtime and how do you focus on yourself a little bit and, you know, to rejuvenate when you're not working?
That's a loaded question. I'm a mom too. I honestly I don't even know. So spending time with my son, he's like the coolest. I
Mhm.
I adore him, and that's even challenging.
Yeah.
So I think making sure that I'm like really present
Mhm.
and taking a step back and just actually being in the moment,
Mhm.
because being in a high position where it's like really demanding and then also making this business happen, it's like my phone is glued to my hand, and
Yeah.
my son knows it, he's 3.5, and I'm like, oh my god, like he
Yeah.
doesn't have a phone, but he'll steal it from me. He's like, I
Mhm.
got your phone. I'm like, good,
Yeah.
throw it in the trash.
Right.
So I
But
think like
don't.
spending time with him, like that's really like what
Uh-huh.
I do in my downtime, but really like cultivating the skill of being present. It's This day and age is really hard because
Mhm.
we're in like the social media age, and like, I didn't have a phone until I was like past high school and could pay for it. Like had my
Yeah.
first restaurant job and was like, I got a phone.
Right.
And I got a friggin' BlackBerry.
I had a pager
Yeah, remember those? Oh
in
my
high
god,
school, that
yes.
was it.
Yeah.
I mean,
So,
yes, it makes so much sense. It's so important to take that time away and to be present, especially with family and stuff, because
mhm.
that's kind of my happy place. I love, being around family, and I've got a ton. I'm one of 9, so I've got brothers and sisters that live here in Ohio, and lots of nieces and nephews. So it's nice to be able to take that time and absorb that. Just be
Yeah.
present in the moment and enjoy not being at work sometimes because that kind of helps to maybe you get some new ideas. And that's usually where a lot
Yeah.
of my ideas come from when I'm not working and I'm like, oh, I need to write that down.
It's so true.
So, okay. So, how can anyone find you if they are looking for some help within their office and want to connect or learn more?
Awesome. I have a website, moderndistinction.com. You can find me on Instagram, Modern Distinction Consulting. I try to make it a mix of education and funny, and then LinkedIn.
Okay. Cool. Well, thank you so much, Melissa. It was such a pleasure talking to you. And again, like I said, this was right up my alley because I love the whole workflow process. And hopefully, we will chat again.
Yeah, absolutely. I'd love to be back.
Thank you. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.